So stem cells. Talk to me about that. How does one even get into a field like this?
Well, for me, it was by accident because I was trying to get board certified in addiction medicine when I ran into a doctor who has been doing anti-aging medicine and who has been using stem cells. So this was 8 years ago. And I remember when he told me, oh, I've been using stem cells and I treated an autistic kid and look at all these improvements the kid had. And my first response was, what? You can use stem cells to treat patients?
That's what I'm
I
saying.
thought they're still doing research. So this is how just cloistered in this bubble I was, in this bubble that most doctors are in, that you don't know what the latest research is. You don't know the cutting edge modalities that are going on because it's all pharmaceutical wrapped. That's how we were educated. That's how we continued our education. So unless you're looking for something that's outside of the box, then you don't know. Just like nowadays, after stem cell therapy has become quite popular, still, if you talk to most doctors, many will say, well, there's still no evidence it works. When there are thousands and thousands of studies that have been going on from around the world proving that stem cell therapy can help a very wide range of conditions. So that's why I started to educate doctors and do basic presentations showing what kind of research are existing. But that's how I got into it. It's by accident, by running into this doctor who was able to produce these wide range of improvement in this kid when I was trained as a psychiatrist and I've seen many autistic kids, and all psychiatry was doing was throwing drugs either to sedate the person or to maybe help them focus a little better. So either psychostimulants or huge antipsychotic medications or antidepressants, anti-anxiety medications, all symptomatic treatments, but not focusing on why the child is not communicating, is having all these problems in the first place. And to see somebody like this doctor who was an anesthesiologist, who knew probably not very much about autism, but he could make that kind of transformation in this child that I had no tools of producing. That made me wonder, what is going on here? What have they not taught me in my training?
You said pharmaceutically wrapped. What exactly does that mean?
Means that everything we do is looking for an answer from drugs. So as medical doctors, the way we were trained was not to learn anything about how to keep a person healthy. We do not have the tools. We were trained to wait until a person gets sick. And once a person's sick, all of a sudden it's like we all came alive. You like comic stuff, a person all of a sudden comes alive. Oh, now I can help. Let me run the test. Let me do imaging. Because every test I'm doing is to figure out what the diagnosis is. It's very focused on diagnosis. Why are we focusing on diagnosis? Is because diagnosis will give you what drugs to give a person. All the drug applications, all the approvals from the FDA is given toward a diagnosis. So the diagnosis is the connector to medications. So that's why the doctors are so focused on giving you a diagnosis. They're so anxious to just land on a diagnosis so then they know what drugs to give you.
All roads lead to drugs.
Exactly.
Is it pharmaceutically wrapped means all roads from every diagnosis eventually end in, I, as the doctor, am going to give the patient a drug.
Sadly, you're completely correct.
Mm-hmm.
Yeah.
Okay. What's wrong with that? Why do you have a problem with that, shall we say, Western medicine ideology?
Well, first of all, the drugs are targeted toward very narrow view of what's going on in the disease. It's focusing more on the symptoms. How can we make the person's symptom a little better? Rarely will it target why the disease happened in the first place. So that's the problem. You have all these petroleum-based products that needs to be utilized, right? All these patents that can be obtained to alleviate some kind of symptom. The problem is, if you have an acute injury, yes, some medications or acute infection, medications can be very helpful and very powerful. But when you come to chronic illnesses, which is a majority of what people are suffering from these days, you just, by focusing on one potential relationship from a drug to a symptom, often is not addressing the web of problems that's causing the disease in the first place. That's why, I grew up in China. So I spent my first 20 years in China, and there's no discrimination, at least not in my house, between Western medicine and Eastern medicine, because some work better for one and another one work better for something else. But in general, for acute conditions, the Western medicine works really well. For chronic illnesses, we seek the wisdom of the Eastern medicine, because
for the audience ear, the difference between acute and chronic illnesses, briefly defined. How would you
so
state
acute will be acute infection, acute injury, trauma, something that needs surgical solution.
I break my arm, I'm in a car accident.
Yeah, something
like
just
that.
happened.
Okay.
There's a cause, a cause, and it happened, not very long ago, and you can acutely fix it. But
Understood.
chronic illness is very insidious. You don't know that you are getting sick. You're slowly getting sick, like type 2 diabetes, right? Your blood sugar started to be out of whack. You're gaining weight. You're not sure what's going on. And then by the time you get diagnosed, you probably have been dealing with it for 10 years. But you just don't know. All these inflammation are going on in your body. So these conditions is going to need a different approach. What I think of it as a system approach. So you approach these conditions with you rise yourself to a level above. So you're looking at all these web of relationships. When you start to look from a system approach, all of a sudden everything can come together, and you're addressing multiple causes. And this could be why Eastern medicine is working so well in these chronic conditions, is that they're not throwing just one chemical, one molecule at you. They're giving you maybe 10, 20 herbs in this concoction. Each herb may have hundreds of chemicals, of molecules in it. So you have this soup of things that we know can help the body in general. It's hard to know exactly what's doing what, but if you use a system approach, then all of a sudden, somehow they're working together. Just like, to give you a very visual example, if you are doing any kind of research, let's say a brain condition, let's say dementia, a doctor can give you a chart of hundreds of neurotransmitters, different receptors, and different different molecules, cytokines, and they're all in this chart, hundreds of them. And one can increase the level of something else, and that in turn can decrease the level of something else, and that can in turn increase the level maybe of the first one. I mean, all of a sudden you got this web of craziness that you are staring at. How do you know what's doing what? So you have to rise above it, right? You have to look at how these things are working together. That's why maybe one day artificial intelligence is really going to help us. But to just targeting linear A to B relationship will keep you from looking at the full picture. So if you're just attacking, the web of hundreds of molecules, and you're just targeting one, and that's what Western medicine is right now. They're looking at a very simple relationship.
And it's not getting to the root cause.
No. Unfortunately, people may temporarily feel a little better, but they're not really getting better. They're not healed, but they think the medication is really helping them. They end up being stuck on this medication. They think, oh, it's helping me a little bit. I was thinking, if I don't take this, all of a sudden some of the symptoms come back. It's not because your body is craving this medication. It's your body has all these other things that's wrong. But this medication is giving you a little relief. So you think that medication is good for you. Just like, let's say Pepsid, right? Some kind of antacid. It is destroying a lot of things in your digestive system and preventing you from being well. But if you stop taking it, all of a sudden, oh, I got this acid, reflux, and I don't feel good. So I have to take it. I need to take it. Then you're stuck on it often for life. So it's great for business, for big pharma business. It's really a fantastic business model, but unfortunately...
It opens up an insidious conversation about that. This is where you have people like RFK Jr. talking about the, relationship between Big Pharma and the doctors that prescribe them, how it interacts with the actual person, how you're not only not getting better, you're now codependent on this company to keep supplying you their product, and how these companies might in fact be doing this to you intentionally. Taking it even a step further, we want you sick. We need you sick. If you're not sick, my product doesn't sell. We need to figure out ways to make people more sick. That is... What's your take on that? I mean, how far down this road do you go? Since you're obviously operating outside of this system, this loop that people get stuck in when they have chronic problems, what is your opinion on that?
This has been proven over and over and over again with more natural forms of therapy, such as ozone therapy, stem cell therapy, peptides. There's a lot of opposition to healing, to people feeling better, because it's destroying the bottom line, right? It's eroding their profit margin. So whether or not is intentionally being evil or just being so focused on making money and wanting people to stay away from, to steer them away from anything that may jeopardize their profit margin. Unfortunately, that's, is that evil? That's selfishness.
It's definitely greedy.
Yeah.
It's a form of evil, certainly.
You mentioned a link between Western medicine and petroleum-based products. Any reason for that? Why petroleum-based products?
Well, if you look back at the history of medicine, at the beginning of the 19th century, the more prominent form of medicine was more natural-based, naturopathic, or the more holistic approach, herbal remedies. It's helping people a great deal, but a smaller proportion of medical practice was allopathic medicine, and there were three major forms. They do surgery, so they cut people, or they bleed people, or they give people substances that can often be pretty toxic. So they weren't very popular. But Rockefeller came in, and
how did I know?
It's single-handedly. It's amazing what one person can do if you have a lot of money. So he wanted to promote, because petroleum, that's
Standard
his
oil
wheelhouse. So all these chemicals, what do? How can you make money from this? Then he started promoting this allopathic branch of medicine and started donating to all these medical schools. And how convenient when you donate. What he was saying is, hey, we just gave you all this money. Don't you think it's reasonable for us to have someone on your board to make sure the money is well spent? So that's how it started.
To choose how your young MDs are going to be trained,
and then look into the origins of the AMA and how did that come about? And there's
exactly.
The AMA. What's the AMA?
American Medical Association.
Got it.
They, as far as I understand, they license and they accredit schools, right?
Yeah, they have a lot of control, a lot of power.
This was started or founded by the Rockefellers, the AMA?
I can't speak to that directly, but from what I understand, a lot of people that did come up through the allopathy, they were put in prominent positions in the AMA, from what I understand.
Yeah, and the other forms of medicine, the doctors were trained from them, are given less and less privileges, and they can do, they're more and more restricted in their practice. So it's interesting. I didn't know. Their reach is pretty far. Someone wrote a whole book on it in China about how the reach went to China, how that was squeezing out the traditional Chinese medicine and vilifying the Chinese medicine. So there's some kind of prejudice now, even in China, against Chinese medicine because of this sense of superiority that we have the science and we have the truth. Yeah. So
even to a layman, we hear that, we feel that. Like when you think Eastern medicine, you think, I don't know, a shaman in a tent giving you ayahuasca. And a lot of times, even that is a good example. That can be helpful.
But the good thing is things have changed a lot. When I first came to the U.S., that was 33 years ago. I remember feeling that I had to be careful talking about acupuncture because people are going to think I'm weird. I'm out there. But look, I think 15, 20 years ago, acupuncture is covered by insurance.
Yeah.
All of a sudden it's accepted. So now
everybody, yeah.
Oh, really? Everybody talks about acupuncture and it's okay. So things are changing. And why, how does acupuncture work? Energy channels, right?
Energy channels,
That's not Western medicine, so why is that accepted? Like, we're talking about energy now.
I think a lot of it really does come down to education. Not education in terms of the practitioners. That's usually, if you're a medical practitioner, you can probably explain to them what acupuncture is. But again, for the layman, for the average person, trying to dispel some of the myths around these things and explain to them, like the like acupuncture, like, hey, listen, these are going to open up energy channels. You have, this thing in your body, it's called chi. Like, this is going to create this this is going to help with this problem. You're having this issue. A lot of people are like this seems like a lie. This seems like you're taking my money. Like you're a snake oil salesman. It doesn't. So I think there is a certain amount of education and promotion that has to happen.
Well, also science is advancing, so more research has been done. So all of a sudden we are putting scientific language into ancient therapies. So now we can figure out, acupuncture is working because of the release of all these chemicals, and that triggers the interaction with the brain and with other immune system. So all of a sudden you have language from the Western medicine. Then people say, okay, now I can understand why it works. So slowly, then there's more acceptance. So that's, one of the grassroots movements, which brings to stem cell therapy, which I think is another grassroots movement, because I can't tell you how many doctors I've worked with who came to me, not because they're so excited about stem cells, it's because they said, well, I've got 4 or 5 patients asking me about stem cells, so can you teach me how to do it? Because I want to be able to utilize it. So people are driving it, just like your dad, right, received a treatment, and he got great benefits, and he started telling people. And who wants to suffer, right? No one wants to needlessly suffer. So then the word will spread, and the word spread within the medical community as well, partially because doctors are humans and they can get sick as well. So what's interesting is that this whole branch of new medicine, you can call it anti-aging medicine, functional medicine, integrated medicine, holistic medicine, is all the same thing. We're looking at the body as a system, how to prevent decline and how to address the root problems. So this community are composed of doctors who are either highly open-minded, really wants to seek more effective treatments, actually help their freaking patients. So
Amen.
That's one group.
Exactly.
The other group were actually pretty, caught in their bubble, but then they got sick. All of a sudden, they tried everything. They trusted all these doctors that they think are big names, right, in the specialty. So they went to everybody, and then they weren't getting better. And then somebody may have told them some silly little, herbal, concoction or something that's woo-woo. All of a sudden, they're getting relief. Yeah. So what do you think they're going to think? What's going on here? I've seen all these big specialists and not getting better. So let me look into what's happening. And once they start opening that door, then they realize, oh my God, there's all this wisdom, there's all these potentials, and there's actually research going on supporting this whole other branch of medicine. And that's how they got into it. Or their family member, someone close to them that just was not getting relief. And they may have tried to help them as much as they can, and not until they did something alternative did they get better. So these are the two groups of people who are, pushing this new form of medicine forward.
Have you ever read the book Good Energy?
Not yet.
I think you'd like it. It speaks directly to what you're addressing. It addresses the problem of taking medical doctors and putting them into specialties, like to where you only do this one thing. And if anything's outside of that little bubble, you don't address it. You refer. Yeah. That's what you do.
Oh, this is what makes so fun to do stem cell therapy, because my very first patient, the story is always very powerful, because my very first patient was 69-year-old who had osteoarthritis in both of his knees. And 2 orthopedic surgeons said, you absolutely need knee replacement. That's the only answer for you. And then he came to me because, of course, he didn't want to be cut open and get 2 new knees. He said, what can you do? So what I did was I gave him an IV stem cell treatment and then injected a very small amount of these cells into his knees. And the first thing that he noticed was the next morning, he said, I slept through the night, because for about decades since his big accident, automobile accident, he had rotator cuff injury. And he will wake up every time he shifts his body in bed. And after the stem cell treatment, I didn't even know anything about his rotator cuff. I just didn't know about it. So I was focusing on his knees, and I put cells in his veins. And what's interesting is that his rotator cuff is fixed without me knowing, right? And his knees are amazing, because this is 8 years later. He walks about 4 miles every day. He goes to more trade shows than anybody I know. Trade shows are pretty challenging. You have to walk a lot. You be on your feet. So I was not an orthopedic surgeon. I was not trained in it. And so that was very empowering. Here I was trained as a psychiatrist. I had no business getting somebody well in their knees, right? So, but that speaks to the power of stem cells, because the cells themselves is very holistic. I can't think of anything more holistic than the intelligence behind making you, basically generating this whole organism. And not only orthopedics, I'm doing things that cardiologists can't do, pulmonologists can't do, rheumatologists can't do, neurologists can't do. I'm producing results in all these people that belong to different specialties, but I did it with simple, elegant infusion.
For the layman, can you explain what is stem cell therapy and what are the different ways that it's administered?
So stem cells, the earliest form, the very first stem cell treatment we did, that we knew were stem cells, were actually bone marrow transplant. Actually, when they first did it in the 60s, no one knew that was stem cell therapy. But then that became known as a stem cell therapy. We're transplanting stem cells from one person to another. So that's one form. You can get cells from the bone marrow. But just imagine, we all came from a single stem cell, which is a fertilized egg. So from that one cell, just imagine that tiny, tiny little cell. How did it know to make you, right? How did it know what is in that one cell? And that speaks to the power of the intelligence that's embedded in the DNA. But that one cell is extremely potent. And that cell will start to divide and then migrate and forming a ball. And that day 5 to 7, within the ball of cells, there may be some other cells, and you can get one of those cells out, and that's considered an embryonic stem cell. So that's where the whole research comes about, right? So that embryo end up being destroyed. This is why there's the controversy, why George W. Bush banned federal funding for that kind of research. Doesn't mean the research is not going on, but no more federal funding. So that's very early stem cell. And that's not used clinically in this country. And then from there, the baby's forming, and there are people who are in other countries who are using fetal stem cells. So when women go through abortion, so in some countries they will actually use the cells from the fetus, not legal in this country. And then it comes, the cells keep dividing and keep forming this new baby within the umbilical cord. Research has found that you have all these cells, and that actually is the type of cell I use, because we only obtain the cord when the baby is born live and healthy, right? The cord is cut, that tissue is usually tossed in the biological waste basket, and now we know we can harvest them by asking the mother if they're willing to donate. So within that cord, what's fascinating is that research has shown clearly that the cells within that cord is in between the embryonic stem cells and the baby's stem cells. So whatever stem cells that's floating around in the baby, the umbilical cord cells are actually more potent, with more differentiation potentials, more kinds of growth factors they can secrete.
How is that? Why is that?
Wow.
Why is it
because
more
they
potent?
were trapped during the time the baby was forming.
Oh.
So
That
the
is so
cells were
interesting.
still
Oh,
early.
how
They were early,
fascinating.
they were young. So that's why it's so it's ethical and it's potent, right? You're not hurting anybody by obtaining.
Yeah.
And it's actually more potent than the baby stem cells. And then as we keep growing, as a human, our body will have all these stem cells in it. They're blood stem cells in your bone marrow and blood, and there are mesenchymal stem cells that are all around your vasculature. These are kind of the coordinators for regeneration, and we can talk about that later. And then you have tissue-specific stem cells. So in any of your organ, let's say skin, there are skin stem cells that help you make more skin cells. So that happens in all of your organs. So when people say, what is stem cell therapy? Oh my God, there's so many kinds of stem cells. Which point are you using? So that becomes complex, right? Because at different points since the inception to, you fully formed human and getting cells from your organ, there are 1,000 gradations, 1,000 shades of how the cells are, because as you differentiate and develop, so differentiate means gaining more functions, but when you gain functions, you lose potentials. So that you can't have both. So when you gain more capabilities and specialize, then you lose the ability to become more types of cells. So as you go down the evolutionary pathway as a cell, then you lose your ability to become all kinds of cells, and you focus more and more narrowly until at the very end you get tissue specific stem cells, and those can only make cells of that tissue. So that's so we can use cells anywhere along the way.
That is so interesting.
It is beyond interesting. How long has this been available in the type of stem cell research you are currently doing? How long has this been in the US?
If we're looking at using cells from the umbilical cord, it's probably in the last 20-25 years or so.
I was going to say it's relatively recent. I mean, I remember the first time. Do you guys remember the first time you ever heard about stem cells?
Yeah, I think it was Dirk Nowinski or Kobe Bryant. One of those guys went to Europe to get stem cells on their knees, I think.
I remember it from Mel Gibson. When Mel Gibson went on Joe Rogan, took his dad down to Panama. And I think this is also why it was sort of beyond the obvious, taking from the, unborn child thing. It was a little controversial because for a very long time, it was only offered overseas or in South America. It wasn't in the U.S. And for a very long time, I remember there was even a Family Guy episode that made fun of this. No one could understand why it wasn't offered here. And that added a level of, shall we say, questions as to why.
Well, let me just tell you, that is a big myth because it's always offered here. It's just what you do with it. So it's interesting that myth is generated, which is probably very good for business for clinics overseas. Because if people think that you can only get it overseas, of course, they'll flock overseas. But the truth is, doctors more and more are providing stem cell treatments using cells. If you don't expand the cells, which means growing them in culture to huge numbers, and you don't manipulate them and change them in any way, then the FDA considered them tissue transplant. So you're not making a drug. If you start to manipulate the cells, grow them in big numbers, then you're making a drug. The FDA thinks you're making a drug. Then you have to go through FDA clinical studies, which is very costly and very time consuming, energy consuming. So all these clinics would just go overseas because they think you need a higher number of cells to achieve a good response, because that's what research has shown. What's interesting is that now so many doctors have done the form using native stem cells. So native means they've never been manipulated, no chemicals, no enzymes were used, and they have not been grown to large numbers. Whatever you separate out from the tissue, that's it. That's what you're going to transplant. At a fraction of the number of the expanded cells given overseas, you can achieve the same results with less side effects. So that's what's been going on in this country, and what I've been teaching doctors and what I've seen clinically and from doctors that I've worked with, that they share stories with me. And a very good example was actually one patient of mine who's a 9/11 responder. He went to Mexico because he heard, I think it was Joe Rogan, talking, there's another guest talking about stem cells and this clinic in Mexico. So he went there because of Joe Rogan, and he got some relief in his lung symptoms in about 2.5 months. But for 2 months, he was having extreme fatigue. Why? Because when you start growing the cells, it's stressful for the cells to be in the foreign environment in some kind of culture that you decide to be good for them. And they start to secrete inflammatory molecules, and they also start to differentiate, because very rarely do they actually divide into two identical copies, in particular conditions. If I tell you the definition of stem cell, really the one of the definitions is that they're capable of asymmetrical division. So they will always preserve a copy of themselves. Every time they divide into two cells, one is identical to themselves. The other one is the daughter cell that's just a little different, gaining a little function. So that's how they preserve themselves, right? They're the stem, the root. Yeah, they clone themselves, but then they're also giving off other cells that can perform other functions.
Interesting.
That's how. So when you start to grow the cells in a culture, they don't just, I just keep making identical copies of myself. They often make these other cells that are differentiated. When you start to differentiate, that means the DNA's at work, you're making more proteins, more surface receptors. All of a sudden, you're expressing the genetic expression of the donor, right? So when you start to have all these foreign expressions, when you inject the cells into a recipient, then you can cause rejection, the rejection type of response. So this person, this 9/11 responder, not only him, but the 20 people who he was in touch with on the same day from the clinic, everybody got extreme fatigue for 2 months. So, and then he found me and came to Los Angeles to get treatment. He said, I wish I found you earlier, but he got his second stem cell treatment with us. And we're using native unexpanded stem cells. And not only he did not have any fatigue, he got increase in energy. And within 3 days, he could feel that his breathing was better instead of waiting for 2.5 months, right? And then he came back later to do a third treatment. So the second stem cell treatment from us. And just about a month ago, he told us he was so excited. He said, I just got my new CT scan and my lungs are clear. He said, I'm the first person ever that's 9/11 victim, right? Whether civilian or a first responder that got cured of lung disease.
Wow.
Oh my gosh.
Yeah.
That's amazing.
It is
And
very inspiring.
This started in 3 days. That's very,
He
very
started
quick.
feeling better. Yeah. Now he's sprinting. Before he was, this is someone in his 40s. A lot of his colleagues already died from the damage of
from the
toxin.
damage from all the inhalation.
Yeah.
And it's not, what's amazing about it is that it isn't localized. It isn't like you're injecting it in your elbow to fix your elbow. You're doing this throughout the entire body, and it's fixing, as you said, it's issues you didn't even know were there.
Yeah.
It's addressing just the entire body as one whole organism from these. How long does this typically take to show that type of, using your therapy, how long does it take to show results in somebody who comes in for their first time ever? And I only have this through the subjective lens of my father who got your treatment, but he noticed it in about a week. I mean, is that normal?
It's very normal. But the thing is, we can never tell. Each person is so unique, right? Their whole history, how they got to where they are, and the mechanism of why their disease is happening is so different. So sometimes I see people who are responding within 20 minutes of the treatment. I have patient, for example, this one patient, she had rheumatoid arthritis, and she's a surgical technician, hadn't been able to work for 2 months. And in the middle of IV infusion, I'm, just watching the IV drip and talking. And then she did this. She closed her fist and she started crying. She said, I have not been able to make a fist for 2 months. Oh. And so she went back to work, after the treatment. So it can happen that fast because anti-inflammatory actions can be very fast. Yeah. Like I have another nurse who I treated. She had so much pain. She's a surgical nurse. And then she would be standing in the OR basically in drenching sweat because she was in so much pain. So, and no one could diagnose, right? It's like someone said, or her doctor said, oh, you have some kind of autoimmune condition. No one could give her the name, right? Mm-hmm. We're all searching for the name. There's no name. Okay, we're giving names to the same thing. We're different names. It's really the same condition, which is immune system out of whack. I mean, that's really what it is. Mm-hmm. For everybody, manifests differently. For somebody, it's the gut. For another person, it's the brain. For somebody else, it's musculoskeletal. So, why don't we focus on the root problem? Because the treatment really end up being the same anyhow, even if they give you different names. Maybe they may have slight differences, but the steroid is one thing that they're giving people, mm-hmm. which has a whole other, set of problems. Mm-hmm. But temporarily, it reduces inflammation. But what if you use stem cells? It reduces your inflammation while boosting your immune system without side effects.
Is that temporary or does it wane over time?
This is what I say. Why did you get sick in the first place? Right? So I can make you feel better temporarily, but if we're not addressing all the root causes, yes. Who says that it's not going to drag you back where you were?
Sure.
So how long it's going to last also depends on whether or not we can remove some of the root causes. And that's why in my clinic, I drill it, in doctors I work with, is that we need to treat the body as a whole. We need to uncover as many root causes as possible. And the patients, you need to eat better. Stop eating junk yes. and putting toxic stuff in your body. You are made of these food items. You can't just put keep putting junk and
Is that-
expecting a great result.
Is that where you would land this? Because you keep talking about the holistic system, the problems with inflammation, the body's an organism, all these problems that are coming. Where is this all coming from? Like, why is everybody sick all the time, everywhere you look? Is it our food? Is that the most obvious answer to this?
I think us as humans, we've, with our technological advances and with our limited consciousness, that we have created a pretty toxic environment. So that comes from your food, comes from the air, it comes from the cell phone towers. I mean, we're bombarded with all these things that we are, we're bathed in. Mm-hmm. So yeah, the rate of autism has skyrocketed. What's going on? Why?
Not just that, the rate of obesity, type 2 diabetes, the rate of autoimmune disorders, the rate of everything. I was thinking the other day, if everything that I do on a daily basis, training 7 days a week, eating perfectly, taking every supplement I can get my hands on, living this life to the best that I possibly can, better than anybody else I know, if all of that equals me feeling like this, and I feel good, but how in the world does everybody else feel all the time? Like there are days where I'm fatigued, I'm tired, I'm exhausted. How in the world can anybody feel good ever? Because I know I'm affected by the cell phone towers, the air, the plastics, the neurotoxins, and everything we touch. I know I'm affected just like everybody else. How in the world is anyone okay?
And it's not just environmental factors. It's the things that we're not doing. Like, we're not getting enough sunlight. We're not going out and hiking. We're not grounding. We're not doing those type of things too. So we're taking those out, those things that we've evolved over time doing and that have been proven to be healthy, and we're removing that stuff and we're replacing it with artificial stuff.
We're designed to be well. I mean, there's the whole system in place, right? Like you said, the grounding, the earthing, like the sunshine, all these things are there to keep us in equilibrium. And then we're removing all these ways that nature has designed to help us. Yeah. So no wonder.
Yeah. It's tough to talk about this as many times as we do, because this topic comes up, I don't know, every 3 guests. Why are we sick? Why are we fat? Why are we this way? But it keeps coming back full circle to the same type of things. We're not doing the things we need to be doing, and we are eating and consuming and being around elements that we never evolved to do. We never evolved to be staring at a screen for 9 to 12 hours a day. We never evolved to be eating the high processed foods that we eat every single day, and to be feeding that to our kids, and to be just that is why. But the problem is that's not sexy. That's not, to us, we don't like hearing that. People don't like hearing, oh, you are the way you are because you made bad decisions for 25 years in a straight row. You are the reason you are as bad as you are. You need to change everything about your social standing. You need to stop drinking. You need to eat better. You need to probably get rid of most of your friends, because those are kind of in your way. They're making you do this. That is a very not attractive answer to people.
It's too hard.
It's too hard.
Yeah.
There we go. Those are three words together that I hear. It's too hard. Well, then you will stay sick. And that sucks, because it's not everybody's fault that this is the society that's been foisted upon us. That being said, I hate allowing people to have that as a scapegoat, saying that they can't get to the gym, they can't eat better, they can't make better decisions to be more well-rounded around their environments, or make an effort to get in the sun. Or I don't buy that. I think it is well within our control, but again, it's not something that Western medicine pushes. They want you on drugs.
Well, as a medical doctor, I'm obligated to help everybody. So even if people who are on the lazier side, who don't want to make changes to their lives, I'm not going to say that I'm not going to give you stem cells, right? So what I've seen, interestingly, there are some people who actually want to stay exactly the way they are as far as their lifestyle. They want to continue to eat that fried food and, whatever that they enjoy, sweets. And they don't really want to do these exercises. They the supplements is too cumbersome. I mean, all these things that I'm suggesting. Oh, no. So, but then when they got stem cells, they did get tremendous relief of their symptoms, all these aches and pains. But I said, you don't have to do it as often if you are doing all these things right for your health. But then they're I've seen them. They say, well, it's okay. I need to enjoy my life. I want to enjoy my life. Okay, well, you can still enjoy a little life even if you make modifications. But people have their mind made up. So I've seen people who said, oh, I was doing great, but after about the 4th month, 4 month mark, then my aches and pains are coming back. So I need to come back and do another treatment. So that's their method, right? They keep doing what they're doing, and they're using stem cells as a way to fight back some of this deterioration. Yeah, that's fine too, but he probably will do way better with higher quality of life if he could just change some of the habits.
Speaking to stem cells, the quality of the stem cell, is that dependent on the donor, or is it dependent on where the stem cells are being extracted from?
Both.
Or both.
Yeah, absolutely both. So donor, of course, is important, and we have very strict screening when it comes to who we accept. So the mother has to be young, under age 30. It has to be obtained from cesarean section, so elective C-section, not emergency C-section. So they planned out so we can obtain the tissue in a sterile environment, not going through the vaginal canal, which has a lot of bacteria. And then we screen them for their family history, of course, their own health history, their family history, their work history, toxic exposure, travel history, sexual history, their prenatal. So everything that we can think of that may possibly affect the quality of that cord, all that is screened for. So we only take people who have pristine answers. And those are the people we accept. And also, not for everybody, for me in particular, I think majority of the labs are accepting COVID vaccinated donors. But for me, that I would not. That's something that's important to me.
Why?
Well, that's first of all, there hasn't been enough studies for these vaccines, and we've seen a lot of potential damages. And we do know that these mRNAs can get into a lot of tissues. So I don't, because I don't have enough data of whether or not this is going to be in the baby's tissues. And I'm just not going to risk people's health, by giving them something that could potentially be an issue. So that is just something that I insist on in the product that I use in the clinic. Also, the products I sent to other doctors. So I also developed my products, which comes to the subject of extraction. So how are you extracting? The process is important, but also what kind of cells are important, because there are different types of stem cells, right? All these variations of cells within the umbilical cord. There are different compartments. A lot of the companies, well, most companies, almost every other company, use one compartment. If they're extracting from the birth tissue, they're either using the umbilical cord blood, so the blood that's flowing through, or the umbilical cord tissue itself, which Wharton's jelly is the big component. So that's the tissue wrapping around the blood vessels. And then you have the amniotic membrane, the membrane part. So all three compartments will have different types of cells. Even if they all have mesenchymal stem cells, MSC for short, those MSCs have different properties when they come from different compartments. But the cord blood also have all these other cells, which are primitive immune cells and the blood cells for bloodline regeneration. So what I've seen is from each compartment, people are getting great results, but nothing works best for everything.
Okay.
So what I said always is, if God created all these cells, who am I to play God, saying, I'm only going to give you one of them. I know this one is good, so I'm going to deprive you of the other types. When we know from research, these cells actually work together. There's synergistic benefits, just like for autism treatments. And this one study was looking at using umbilical cord blood cells with the mesenchymal stem cells versus just using one cell type. The combination always wins. It gives you better results. So in my formulation, I'm putting all three cells from all three compartments from the same donors together. So I'm giving people a comprehensive cell population. When mothers do save the cord for their babies, and almost all tissue banks that I know of, they all preserve one cell type or another. So you're not from one compartment or another. So you're not really going to get the comprehensive population. So anyhow, there's so much to talk about, what kind of cells to use. But basically, no, they're not equal. It really depends on how you're processing it. And also the viability. Different labs have different techniques. And by the time you get the cells out and then freeze them and then let them thaw, thinking that they're going to come back to life, that is not an easy process. You have to be very methodical so that the cells are gradually decreasing their metabolic activity and they're literally frozen in animation. But by the time you thaw them out, you need to thaw them out really fast so they come back to life without the possibility of all these crystals forming, puncturing themselves, and then all of a sudden they're dead. So the process, how you're dealing with the cells, is very important.
Yes. What is the cost of stem cells as far as a patient when they come to see you?
I would say there's a wide range. You can find treatment for a joint injection probably, at $5,000 in the U.S. But
one treatment.
Okay. But you can, if you use more products, then the cost is going to go higher. If you use your own cells, bone marrow fat extraction, that probably is going to go upward from $10,000 up to $30,000.
It's more? to use your own stem cells costs more.
Yes, because doctors have spent a lot of money training and getting their equipment, so they do want to recoup the cost.
I was going to say that doesn't seem like a better, more optimal way.
Yeah.
It seems less invasive to not take from your own bone marrow.
It could be more expensive because that's considered a surgical procedure, right? All stem cell treatment. I mean, they're all procedures, but because just like plastic surgeons, right? What's his cost? Well, not much cost.
Not what he's charging you.
He's performing surgery, so he's charging for his skills in the surgery.
Yes.
So if you use birth tissue stem cells, they are expensive to purchase from the labs, and then the process of administering it. If you're doing stem cells, let's say you come to clinic to see our doctors, it will range for an IV infusion. It will range between $8,500 to upward to about $20,000, depending on how many cells, how much we're going to need. That's based on your body weight, your age, and your health issues. And that also depends on how we're going to administer it. Are we going to do something intranasal? Are we going to do local injections into your joint or your face or your penis, vagina? Like, there are all these
I'm
ways.
sorry. Hold everybody stop. You can put stem cells into your penis?
Yes.
Okay.
Why?
That has been pretty popular.
It is?
Why?
What does that cost?
Well, you, as a man, know how important this organ is.
I do.
And I think men are pretty obsessed with their penises. And they all want it bigger and firmer. And, right? I mean, isn't that a common theme? Am I mistaken?
No.
Stem cells will make it bigger.
Jake it is.
Yeah, hold on.
I've heard of it.
Say that. Ask that again.
Well, stem cells will
Increase-
make the size
increasing
of your.
girth.
It will increase girth,
Girth?
length.
It can. Length, I'm not sure, but girth, yes.
Interesting.
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 I just
Unless you're using embryonic stem cells, it might make it smaller.
and this so you administer this
We can.
via
Yeah.
needle
Yes.
into
Yeah.
the
Let me tell you, it doesn't hurt very much at all.
really.
Speaking from experience.
Yeah. Okay.
But no, it actually doesn't. It's actually, it looks more scary than what it feels like. So yes, we can inject into the cavernosum, and it's full of blood, right? So you're injecting into the blood, the pool of blood. What happens when a person gets older is that the tissue gets more scarring. There's less and less blood flow. So you start, it becomes just less functional.
Just based
it
on how
doesn't-
much you've you beat
Used
it over the
it.
years.
Well, really how you're beating up your whole body. I call the penis kind of like the canary in the coal mine. So that's the first organ to, wither and, becoming dysfunctional, because it's an illustration of how your vascular system is doing. Nowhere else in your body do you have such a visual indicator of how your vasculature is working,
Yeah,
right? All
yeah.
your microvessels and its ability to actually have a blood flow into the organ, and the scarring, combined with scarring, the inflammation, all of a sudden you can see visually that your vasculature is affected. So if when you address vasculature, you actually can address the function of the penis. So you can do that systemically, and that can help. And when you inject locally, of course, you're getting more signals.
So you inject stem cells locally into the penis, and this works after one treatment. Someone does
people
this.
can notice benefit after one treatment, but
Okay.
usually we recommend a series. A
Would they-
series depending on how much just how much help a person wants. But
Would they
even
come
with
to you for ED? Is that why someone
Some
would come
have.
and do this? Some have ED.
yeah,
Just- okay.
yeah, or for something like if you're the Peyronie's, is like a abnormal curvature of the penis.
Oh,
Is
that's
an
what it's
inflammatory
called.
condition, right? Very distressing condition. It's very easy to treat with stem cell therapy. I've injected straight into the plaque, because there are plaque formation that's causing the curvature. With one treatment, the penis straightens up. I mean, it's pretty amazing.
Whoa,
Yeah.
Wow.
that's incredible. How common is this?
I thought you were gonna ask how much it was.
I want to know that too.
I don't know but I don't think it's that uncommon actually.
Got it.
Yeah.
And what's the cost of that?
Well, I think if we're just focused on local injections, I think it's about $8,500 or $75, somewhere around
Sure.
there.
Yeah.
But I always like adding the systemic infusion, because we talked about addressing the whole body, and you're really having a chance to talk to your immune system, because they are everywhere. They're dispersed throughout your body. There's a big spleen, that's a major immune organ, but you got all these peripheral lymphoid system. When you do systemic infusion, you actually get to talk with all these different organs. And we know immune system is the driving force for aging and decline and infections and cancer, right? If the immune system start to lag in their capabilities, then all of a sudden all these chronic illnesses start to pop up. But if your immune system is strong, then you're going to be able to fight all these things off. So then the stem cells will end up talking to the immune system. And this is one reason I just did a episode on my own experience of me breaking my calcaneus, injuring the bone in my heel, cracking it from jumping off a big rock. And I tried local injections and all these other methods. It was helping somewhat, but once I give myself IV stem cells, not touching my heel, but just an IV, the acceleration of healing was drastic.
Yeah.
So that's
Wow.
kind of like a personal example, but that's what I've seen. You've got to bring the immune system on board.
Yeah.
When it comes to the umbilical cord, you've mentioned the term donor several times. Is there any exchange of money between the person that's donating and
Absolutely not.
Okay.
It's not legal in the US. I can't speak for other countries, but the selling of human tissue is strictly prohibited.
Okay.
So the
That makes sense.
the people who are, there are procurement companies that are obtaining these tissues. They can't even give them a pen. They can't give them anything to entice them to donate. So there's really no reason for them to lie, on their history just so that they could give you their tissue, right?
Yeah.
Because they're getting compensated. That's not the case in some other countries like the Ukraine. I've heard of Russian women getting pregnant just to be able to sell the fetus,
That
So-
could become a problem. Yeah. I
yeah,
can see
so
that.
in the US that's not allowed. But the cells, the tissue, once it's obtained, when it's processed by the lab, right? The lab have all these costs, having the location, having the equipment, having the personnel, and all these regulations and the compliance officers, everybody, that all costs money. So then they charge a fee for their product.
So what would be the benefit of a mother donating her umbilical cord, and how does that all
It's like
take
blood
place?
donation. Have you
Okay.
ever donated blood?
Yeah.
What does it do? You feel good that you're going to help somebody?
Okay.
Yeah.
It's purely a charity. You're giving it because you want to give it.
Yep.
Yeah. No, it's incredible. It's is it covered by insurance? Your practice in
what's
particular?
interesting? This is interesting. Definitely for the first 7 years that I was doing this, there was absolutely no insurance. Maybe I think there's one SAGs, maybe the SAG, the Actors Guild, they may have some killer insurance company. That's a misnomer, but some great insurance policy that actually cover all kinds of treatments that are esoteric. But other than that, almost no insurance companies covering. And now there's almost none as well. But they're starting to be company. At least there's one I know of. It's called Samaritan Ministries. They're Christian-based organization, and it's kind of like a co-op. You know, people pay into the system, right? It's not a giant insurance company. So they recognized that by paying whatever $10,000-$20,000 for treatment in stem cells, they end up saving so much money in the long run. So they are willing to cover it. So we have treated
How do they
patients.
save money in the long run? By paying for stem cells?
Well, they don't have to pay for hospitalizations in the long run. They don't have to pay some expensive drugs. I mean, all these drugs and hospitalizations and all these, you know, cost money, right? They're covering it. Even though they may have some kind of deal with drug companies, but still, that's money. So if they just pay a little bit upfront to have something with almost no side effects, but can promote so much healing, then well, in their calculation, that's why they're covering it.
Yeah.
Surprising why there isn't more, just based on that fact, because you're right, the insurance companies are in the business of not paying out. That's their business. So if they can pay out once and know that most likely you
guess
won't
what?
need more.
The current business model for big insurance companies and big pharma has been working so well for them. You know how rich insurance companies are, right?
Yes.
And you know how rich big pharma are. So it's been working beautifully. So why would they disrupt the whole model? You know, they have to have some soul searching and really coming to an understanding that we're going to disrupt our bottom line. So that's a question for them.
Yeah. Well, it's an ethical question for sure, because yes, the bottom line is nice and secure, but people are also dying. People are also sick all the time, and they're getting worse. So how long will they tolerate this being with people like yourself popping up and offering this, but them being unable to pay for it? The Fountain of Youth exists. Nobody can afford it.
Yeah.
And that's
another
rough.
reason the cost is high is also because doctors who are doing it are still taking on a risk. So they have to, get trained and do all these things. If they just stay within the system, they don't have to worry about something going wrong, somebody doing something, because they're very protected. I always say you can give people the most deadly medications, but because it's part of the consent for medications, including death, right? You've consented. It's okay to take that I give you this because
COVID vaccine.
You know you could die. So now I'm clear. Now I'm in the complete clear. No matter how much harm I'm causing people, I would never be penalized. I would never jeopardize my license because I told you so. But it's not the same thing for these more cutting edge treatments. You don't have that layer of protection.
Are stem cells FDA approved?
No. There's only FDA approval for one condition, which is hemoreconstitution. That's after a person has gone through that they had cancer, blood cancer. They wipe out their blood system, and then they're getting a transplant of either bone marrow transplant or umbilical cord blood transplantation, or they have an autoimmune disease and they wipe out their immune system, and then they are given new stem cells. So these are the only indications that has been given.
This is why individuals who lean very, very hard into the peer-reviewed argument that if something is not peer-reviewed and approved by the FDA and all of those roadblocks have been checked, that they won't acknowledge any sort of treatment as a viable option. And that's where I think it might have actually been Rogan who said something to the tune of, practitioners, people who are doing things outside of the box, health coaches are usually ahead of most of the medical community with what is actually working and not working.
Yeah, because we're looking at the most recent research, right? I'm looking at a research published this year, last month. I'm really keeping track of it. But the whole medical apparatus is like a juggernaut that's very slow moving. And they're 20 years behind the latest research because it takes too much courage to actually implement what's found out now. It's it's just interesting. When I was in medical school at UCLA, I remember telling everybody, oh my God, thank God for the FDA. I love the FDA because they are protecting the public. They're doing so much for the public. I mean, literally, that's what I was, and I was so happy about it. And then I started to hear things, and I started to open my eyes to what is really going on. So for anybody who really wants to understand what's going on, take a look at this documentary called Bleeding Edge. It's talking about medical device and the approval process, take you behind the doors of how it's approved. So just take a look. It's on Netflix, you know.
Or watch Dope Sick.
Oh yeah, also on Netflix, right?
Yeah.
No, the
Hulu.
FDA,
Hulu.
Yeah,
Mhm.
it dates back even further than that. Watch the Dallas Buyers Club. Look what the FDA did to him during the AIDS crisis. The individual, I'm sorry, I don't remember the character's name. It was a real story. It was a real guy. Was bringing over a lot of peptides, protein, basic supplementation from South America to help people with HIV. And the FDA was pushing this one drug that they had a massive investment in. I can't remember its name, but they blackballed him. They shut down his business. They got him arrested. They went to the Supreme Court over this at the time. This whole thing was a massive case. The FDA has been doing this type of stuff and it's really self-serving for decades.
Yeah, when a huge portion of their salary or their their funding comes from Big Pharma, of course, hey, I just gave you all this money. Can you, how about this? How about doing this? I mean, it's just human nature, right? So they're called, really, I wish I could, keep loving the FDA, but what they've demonstrated is that they are a captured agency. So they're captured by the industry they're supposed to regulate. And that has happened with many of our government agencies. That's just what happens. Yeah. Unless there's like a uproar, right, from the public and really demand to change how things are done. And gradually they just get captured.
Yeah. I think you have an uproar, but I think like almost anything else, you'll get an uproar from 50% of the population. Probably not from all of it. The other half is going to say you and I are conspiracy theorists, that you're crazy, that I'm nuts for even putting this on the podcast. And that's how half people think. And that's fine. That's the way of the world. Not everybody's going to agree on everything, but I think it is definitely getting more and more the case that these types of discussions are not conspiracy theories. People are waking up to the fact that no, this is happening in real time. And I can show you three. I'm a moron, and I can show 2 or 3 cases where the FDA has overreached, where they've done something that is not in the best interest of the public. They've done it because that's in their best interest, and that's not even a conspiracy theory or a theory at all.
Yeah,
it's just the way it is.
Well, the thing is, even with all this opposition, the bright side is that in the last 5 years, the number of stem cell clinics in the U.S. has quadrupled, and that's despite all this, the fact that it's considered fringe, that a lot of doctors, think it's exciting, but they're so afraid of jeopardizing, their little livelihood. I'm not belittling it, but their livelihood. So doing the right thing and bringing healing is secondary to their security, right? So their priorities is different. Whereas other doctors, they were willing to take the risk. They're willing to even jeopardize their own safety to actually do the right thing because they cannot think of existing otherwise. Wow. So
you uphold the Hippocratic Oath.
Exactly. Yeah. And those are the doctors I love working with. And those are usually the ones that's coming to me to want to learn. And I see that even in young doctors. Like I just have a medical student who wants to work with us. And he said he's still a minority in his class because most of the doctors are still basically indoctrinated in this particular system. So he's an outlier. But he said, I've gone through the rotations. I see the patients not getting help very much. And I know there's a better way because he listens to all these podcasts.
Yeah.
Right? You hear all these other doctors who are more open-minded, who are doing things that are outside of the box. Yeah. So he's excited. He said, I can't keep doing what they just taught me doing. That is not enough. And I'm not going to, basically, I'm paraphrasing. His soul is not going to allow that.
That's awesome.
Yeah.
I'm happy to hear that. It's also very important to have these discussions. That's why things like this are important to talk about. It's important for podcasters to promote what they believe is actually true, regardless of the backlash. I'm sure these clips are probably going to get censored or we're probably going to have to face that. That's not a problem. I don't care. It's better for me to put out information that I actually believe in, things I know are true. And, you know, we've talked about COVID vaccine. We've talked about topics that you were not supposed to talk about because I think it hurts people.
Yeah.
And because I think there's a way people need to go about taking care of their own health. And just like your medical student, I know there's young people who are coming up that are going to hear this type of thing. It's really expanded, just like the number of stem cell treatments that have popped up in the U.S. You've got more and more people talking about alternative medicine, different options, and that's, I think, just as important today as well.
And what's interesting, this is despite the lack of acceptance from the governing agencies, and despite the restrictions by big corporations that are kind of running our social life, the Google, Facebook, Instagram. You cannot put on an ad saying that I provide stem cell treatment. They're not going to run it because they said, oh, this is unproven therapy. You're promoting an unproven therapy. So this is, it really is a category, they call it miracle cures, which really is another word for snake oil, right? So they believe that stem cell therapy belonged to that category. And my question is, when do these companies become physicians or become medical experts to decide what people can talk about?
Doesn't that infuriate you beyond all belief?
Are they looking for FDA approval before they can run an ad on something?
That will allow them, you know, they probably will feel more comfortable. But the fact that Google bought a big pharmaceutical company, you know, what do you think? So
the whole thing is intermingled and backwards, and you have no idea what and they keep changing their policies. We saw them do that constantly throughout the pandemic. What was once information is now misinformation, and the misinformation is now information, and they keep changing it back and forth. People got banned for things that they can openly talk about now. People got kicked off YouTube for talking about subjects. People with hundreds and hundreds of thousands of people had their platform shut off. Mark Bell had his page shut off for talking about something that YouTube found, and all they have to do is put, this violates our terms of our agreement terms, and they just shut it off. They don't have to explain anything to you. And that's the power that, unfortunately, we've given to these moguls. And it's good to have companies like Rumble and different places where information can pop up again. But information is like anything else. It's a commodity.
Yeah.
And if you have groups of people that control it, they decide what they want you to hear and not hear.
Yeah. But the bottom line is that cat is out of the bag. I don't think that they could ever, you know, put the genie back in the bottle. I almost think of it as, you know, visually as the light coming from these cells. It's like spreading the light. That now we know, we have seen it. We have seen the power of these cells. They're just not going to be able to stop it. Just like in Texas, they passed a legislature making stem cell therapy legal. Like formally say that this is
Texas
legal, right? Because for every other place, we don't know. No one is saying this is legal. No one is saying this is illegal. So we're operating under the gray zone. Why did Texas pass a law? Because one of the senators, his son, I think that's the story. The son, Charlie, it's called Charlie's Law, was helped by stem cells.
Oh yeah, I heard about this. Yes,
so,
I heard about Charlie's Law.
So it's only a matter of time when legislators, they realize, oh my God, this actually really works. It helped me, helped my family, and things just going to start to change. Yeah, it's they can't stop.
They're not going to be able to stop it. Eventually, what they'll try to do is purchase or patent it, and that'll probably be the way it goes, just like most other amazing things. But either way, it's good that it's finally getting out. Thank you so much for coming on and having this talk with us.
Awesome.
Dr.
Thank
Joy,
you so much.
so awesome.
Really appreciate it.
Really, it's incredible what you're doing. You got to keep going. It's important. It's a sin if you don't keep going, and I think you're helping out a lot of people.
Yeah.
Thank you for that reminder. Sometimes I do wonder, this is not easy, and certain entities are not making it easy, but I see people coming to me thanking me for doing what I'm doing, saying please don't stop. So, and there are more and more people that really need my help. They really don't have anywhere else to go. So really it's really a sense of obligation that I have to keep going. So yeah, and besides, I don't live in fear. So like in my book, I talked about, you know, coming from China to America. You know, if I lived in fear, I would have never made that jump. So same thing here. I'm just not going to live in fear. I'm going to keep pushing what I believe is right, and
good.
And we'll see where we get.
If people want to read your book, what is the title and where can they find it?
It's called Tiger of Beijing. It's on
I love
Amazon.
That's awesome.
Yeah, so that's a very it's a story. So people are expecting to see my journey of how I became a stem cell doctor. That really is not the book. But if you really want to read a good story of a young person from a different country overcoming and not taking no for an answer and kind of taking a journey with me. Come with me, travel in China, and come with me, go to San Francisco, and come with me to experience some of the heartaches, but some of the courage and how that life force within us can carry us to victory. And that will be the book to read.
So cool.
Sounds amazing. And lastly, if anybody has questions for you directly or they want to get in touch with you, where would they go to do that?
They can always go to my website, drjoykong.com, or joykongmd.com is the same website. So joykongmd.com, that talks about everything I do, which includes my own clinic, my stem cell company, the stem cell cream that I created called Chara Omni, the academy I founded where I train other doctors, and then the book. Yeah, so
Outstanding.
all the trouble I got myself into is there.
I can only imagine. Well, thank you so much, Joy. Really, seriously, thank you for coming on. Such a great topic and just a great discussion.
Yeah,
really
you guys are
appreciate it.
fantastic. It's a lot of fun. So thank you so much.
We appreciate it.
What's up, guys? Hope you enjoyed that episode with Dr. Joy Kong. It was amazing. If you guys want to see the rest of our episodes or any of the stuff that we put on the YouTube channel, go right here.